My name is Madison Vaughn, and I'm an occupational therapy student at Lincoln Memorial University. This is part 5 of my Caring with Confidence series, and today I'll be talking about recognizing pediatric developmental milestones, what they are, why they matter, and how we can identify when a child might not be developing as expected. To provide a quick overview of what I'll cover in this presentation, I'll start by defining developmental milestones, then go over some yellow flags to be mindful of. After that, I'll walk through development from infancy into adulthood and finish by discussing some support services. I'll now get into an overview of developmental milestones. So, developmental milestones are the skills that most children can do by a certain age. And when I say most children, what I mean is 75% of children at that age. Developmental milestones help us understand how the child is learning and how they are growing over time. The milestones are based on normative data, so it's important to remember that not every child develops the same. They might develop a little differently, especially those with disabilities or complex medical diagnoses. We typically group developmental milestones into four main areas, and those are communication and language, motor skills, social emotional skills, and cognitive development. I want to provide some background into Erickson's stages, which I've talked about throughout this presentation series. So, in addition to that physical and cognitive growth that we see children develop, development also includes that psychosocial growth. So, a psychologist named Erik Erikson described 8 stages that occur across our lifespan. He proposed these stages and how social interactions shape our personalities over our lifetime. Each stage has a central conflict, and how that conflict is resolved is what impacts future development. Success within these conflicts leads to positive traits like hope or confidence. In infancy, so we're looking at the time period from 0 to 18 months, the main stage is trust versus mistrust. This stage focuses on a child's basic needs like feeding, comfort, and consistency from their caregivers. When caregivers are responsive and reliable, the child starts to develop that sense of trust. If not, the child may develop mistrust and view the world as unpredictable or unsafe. The key question for infants is trying to figure out if their world is safe and if it is predictable. In early childhood, so we're looking at that period from 1 to 3 years old, the focus shifts to autonomy versus shame and doubt. Autonomy is having control over our decisions without external influence. So when a child starts to develop independence, including things like dressing or toileting, they need to be encouraged by the caregiver, and that's when they start to build confidence in that autonomy. If they're overly criticized or do not feel supported by the caregiver, they may start to have feelings of shame or doubt their abilities. The key question a child is trying to answer at this stage is if they're able to do things on their own or if they will always have to rely on someone else. During infancy and toddlerhood, daily activities that the child participates in is really what is driving that development. Infants have those basic needs like feeding, sleeping, and early movement patterns that need to be addressed. Toddlers are becoming much more active and they're engaging in activities like running, climbing, communicating, and beginning some of that pretend play. So at this stage, caregivers play a key role in providing a stimulating and supportive environment. I'll now dive deeper into specific milestones from birth to age 5. Developmental milestones are important because they help us track a child's progress across different areas like movement, communication, and how the child learns. As I mentioned earlier, these are based on normative data and will likely look different for children with diagnosed developmental delays, those with special needs, or complex medical diagnoses. If the child is unable to meet these milestones or they are consistently meeting milestones later than what is considered the norm, it could be the first sign that they may need additional support and that the caregiver may need to start seeking out those support services. Across the first year, we will discuss those fine and gross motor milestones, so children are developing pretty rapidly from 0 to 12 months. In terms of motor development, those gross motor skills are those skills that use large muscle groups for big movements. So this would be things like running, jumping, and the child's core stability. Fine motor skills are the skills that are achieved through those small, precise muscle movements. So things like using their hands, fingers, and wrists for tasks like writing, buttoning or zipping their clothes, and their pinch and grip strength. At 0 to 12 months, we do see more of those gross motor movements, and they start to become more purposeful toward the start of 4 months, with more advanced movements like an army crawl at 7 months. We may see rolling, crawling, and eventually pulling themselves to stand in that first year. They can start to develop some fine motor skills like starting to feed themselves with their hands or fingers by 7 to 9 months or picking up items by 12 months. They might even drink from an open cup or eat with a spoon by the end of 12 months. I want to talk about crawling and the importance of crawling. The CDC and the American Academy of Pediatrics removed crawling from their official developmental milestone checklist in 2021. It is no longer considered a standard milestone because evidence really suggested that crawling was inconsistent across children. Many babies were starting to skip crawling altogether, and those who did crawl did so at various ages. However, experts still consider it highly beneficial. Crawling is especially important because it builds that upper body strength, coordination, and stability the child needs. It also helps develop the child's reciprocal pattern of movement, which requires both sides of their brain to work together to create that movement. It also helps develop movement patterns needed for later skills like walking because it promotes stability at the pelvis and encourages more of that trunk rotation. With crawling, children will first crawl on their belly, and you may even see some backward crawling before they crawl forward on all fours. When we talk about language and social development across that first year, within the first year, infants will start to produce a lot of sounds. They will start with cooing, babbling, and they might try to imitate sounds they hear from the caregiver and the family. By 6 to 9 months, they may be able to say things like mama or dada, and they may also be able to stand the word no and begin to wave goodbye. By 12 months, they might reach out to be held or lean in for a kiss or a hug. By the end of their first year, they will start to engage in simple pretend activities like pretending to drink from a toy cup or holding a phone up to their ear. We will now discuss cognition throughout that first year, and the child should be able to see things in black and white by 4 months, begin moving their hand and eyes together for hand-eye coordination by 6 months, and may even respond to their name by 9 months. They should be able to follow simple commands between the ages of 6 to 9 months, and they are starting to develop more of those fine motor skills to be able to place items in a container and also the cognition skills to locate hidden items. So if you hide something under a blanket, for example, they may be able to lift up the blanket to find the hidden item. When talking about language and social development from 12 to 18 months, children are beginning to follow simple commands and use gestures such as blowing you a kiss or waving goodbye. They may start saying a small number of words and pointing to objects in books as you're reading them a story as well. By 18 months, they should be trying to at least imitate words, usually short syllables still, and have a vocabulary of 10 to 50 words. This will be simple words like mama, dada, dog, things like that. You might also see them begin to throw temper tantrums at this stage, especially when being told no. In terms of cognition between 12 to 18 months, the child is starting to recognize themselves in the mirror and they may engage in more of those pretend activities. They may be able to scribble with a crayon and begin to show interest in things like dolls or pets. They might also be able to take things out of a container and put things back in. With the scribbling, you would see more of a fisted grasp, like what is shown in the picture at this stage. We are now getting into the 2 year mark, so we're going to talk about gross and fine motor skills between 24 and 27 months. And at this stage, toddlers are becoming more physically active, including things like running, climbing, and kicking a ball. They also start to develop those fine motor skills like drawing lines or stringing beads. You may see them climbing on and off furniture and using push or pull toys, which is actually great heavy work, which we have also talked about throughout this presentation series. You might see them attempt to climb stairs with alternating feet as well. Language and social skills between 24 and 27 months are also rapidly developing. They're now starting to expand their vocabulary into short sentences, usually of 2 to 4 words. They begin to express independence, which can sometimes show up as defiance at this stage, as they don't fully have the words to express frustration or anger or those really big feelings. They now have a vocabulary of up to 50 to 200 words. They may use terms like I, me, or mine and begin to demand their own way, which can show up as difficulty sharing toys or items. Cognitively, they can follow those two-step directions and solve simple problems. They're able to name some items in a book, and they may laugh at silly or unusual things. You can give the child at this stage two-step directions like pick up your shoes and take your shoes to your room. Just make sure you give them time to process that command. We're now coming up on 3 years of age, so by age 3, children are more coordinated. They can run, jump, and they start to catch a ball at this stage. They also begin helping with simple daily tasks like dressing or brushing their teeth. They're able to build block towers and copy a circle at this point as well. Some activities you may ask for assistance with is setting the table, wiping up spills, and asking them to dress themselves in the morning or at bedtime. By age 3, the language is also becoming more conversational, and children at this stage ask a lot of questions. You may hear a lot of what, where, and why questions. They're not always looking for an answer at this stage, they just want to know that you have an answer. They start to become yes, no reliable, and this means that you can ask them yes or no questions, and they should be able to answer them correctly. They may talk in conversation with 2 to 3 sentences, and their turn taking and sharing skills start to improve as they're building those social skills. They're able to name most familiar items or people in their lives. Cognitively, between the ages of 30 to 36 months, they're starting to engage in more pretend play and show increased attention and self-awareness. They're starting to say their first and last name, and they can point to and name most of their body parts. At this age, imaginary play is important, and they might engage in role-playing games or activities or what they call dress up. They will begin to figure out how to turn pages of a book and open a door handle as well. When discussing the Erikson stage at the preschool level, so between 3 to 5 years of age, the stage is what is known as initiative versus guilt. So in the preschool stage, children are exploring and asserting control over their environment. If they feel supported and they're allowed to have that autonomy and some more control over their decisions, they develop that initiative. If discouraged by the caregiver, they may feel guilt about their actions or their ideas. At this stage, they are answering the question of whether they are good or bad. As we just discussed, by age 4, children are beginning to take more initiative, and because of this, they often want to be a helper at home. They may engage in role play or pretend activities or ask to help with activities at home like the cooking and the cleaning. By age 4, they start to form sentences of at least 4 words, and they're able to answer simple questions. They are able to draw a person with at least 3 body parts, which might look something like the picture I've included here. It would be helpful to have them more engaged with tasks at home, like pouring themselves a glass of water. By age 5, the child is able to understand and follow rules more efficiently. They may like games that involve turn taking. They can answer questions about a story you've read them, and they're able to count to 10. They may be able to write some letters in their name. With writing, kids will start with capital letters as they are all straight lines versus lowercase letters, which have curves. Even with capital letters, it is easier for them to do letters that do not have diagonal lines initially. Their attention span will start to increase, and kind of the rule of thumb with attention is that a child can pay attention for 2 to 5 minutes per their year of age. So if they're 5, you can expect an attention span around 10 to 25 minutes. You might also see them buttoning at this stage. With dressing, it is easier for a kid to undo something. So, for instance, you might see a baby take off their socks before they ever learn to put them on. It's the same way with buttoning and zipping. They'll learn to unbutton and unzip before they learn to button and zip. We'll now shift into yellow flags, which are warning signs that development may not be progressing as we would expect. These don't automatically mean that something is wrong, but they do signal that further evaluation may be needed. For motor development, some key concerns include poor head control after 8 weeks, stiffness, or early hand preference before 2.5 to 3 years of age. If they're not bearing weight through the legs by 6 months, or losing previously learned skills at any stage, these are significant yellow flags. If they're unable to dress and undress by age 3, this is another potential yellow flag. Another yellow flag includes difficulty scribbling by age 4. With sensory yellow flags, sensory concerns can appear at any age. They might include being overly sensitive to sounds, avoiding eye contact, or becoming distressed during grooming activities. These behaviors can indicate challenges with what we call sensory processing, which we have discussed frequently throughout this presentation series. Often the child will need a sensory profile completed to understand their sensory patterns so that professionals can make the appropriate recommendations. There are some great presentations on our KCC website done by Sydney regarding the sensory systems and sensory needs. With communication and social development, some warning signs or yellow flags include limited smiling, a lack of babbling, or not responding to simple words. If they're unable to use words by 16 months, or they're not able to form those two-word phrases by 2 years, these are also important indicators or yellow flags. Extreme difficulty calming or self-consoling at any age is another yellow flag to be aware of. When talking about the Erickson stage at the school age level, so between the ages of 6 to 11 years, children are growing older and their development is continuing through that school age, adolescence, and into adulthood. At the school age, they are trying to resolve the conflict of industry versus inferiority. They are trying to cope with social norms and the demands of starting school, which can be really unfamiliar and overwhelming initially. If their coping is successful, they will achieve what we call industry. If they struggle to meet those school demands and they develop poor self-confidence, this may lead to a feeling of inferiority. Some tasks that are appropriate to delegate at home among this age group are expecting to keep their room tidy, including making their bed, setting or cleaning up the table, folding laundry, and taking out the trash. In adolescence, it's about identity and sense of self, or the conflict called identity versus role confusion. They are focused on forming those social relationships and discovering their sense of self and identity. Discovering their identity and developing that sense of self leads to success at this age or identity. If they experience challenges with developing their own identity and forming those relationships, it may lead to role confusion. Tasks that are appropriate at this age range from things like preparing simple meals, cleaning the bathroom, sorting the laundry, and being able to keep shared spaces like the kitchen or living room organized. In young adulthood, the focus shifts to relationships and connection with others. If they're able to establish those intimate relationships, it can lead to success at this stage or intimacy. If they are unable to form those close, intimate relationships, and this can be with family, partners, and friends, they may experience feelings of loneliness and isolation. At this stage, they should be pretty self-sufficient, including being able to deep clean, meal plan, budget, and complete simple home repairs. I included a resource that was listed on the Ohio Department of Children and Youth website. It's called the Sparkler app, and it gives Ohio families access to the Mobile Ages and Stages questionnaire. So this is a screening that can identify developmental progress in children from birth to age 5. It is free for Ohio families, and the website says it takes about 10 to 15 minutes to complete. I've also included resources. We've talked about early intervention throughout this presentation series. Early intervention does not require a referral from a doctor. You can make a referral as a caregiver on the Help Me Grow website. I've included the number for Ohio Early Intervention Services as well. On the Ohio Department of Children and Youth website, you can look up early intervention contacts by county as well. And these are my references.